Hi everybody, and welcome to the Kidney Coach YouTube channel. I'm joined again today with the amazing Emily Cahill. If you want to know all about Emily and what she does, there should be a previous video here a few days ago that Emily and I did where we just introduced her. But if you head over to our Kidney Coach website and look at articles, you'll see Emily's beautiful face there, and there should be a resource page. If it's not there, it'll be there any day soon on the Kidney Coach website. And you'll be able to see down there what Emily does, as well as on the About Us page. So Emily, thank you for joining us again. First off, I think today we spoke about in the last video, one of the biggest issues that you see in consult. Emily is trained in the Kidney Disease Solution Program. She does a lot of work with our patients that needs more support being walked through the program. And one of the things that Emily and I were speaking about last time was the differences between what a renal dietitian will say versus what's said in the program, and how that does confuse people. So Emily, did you just want to go over that again, what we spoke about last time, and maybe why they say different things and the issues that you see in the differences with the diet?
Yeah, sure. So I guess one thing I've noticed with dietitians and renal dietitians is that the way that they look at food is different from the way that we as naturopaths or nutritionists would look at food. So very much it's that a calorie is a calorie, which means that it doesn't matter where you're getting your calories from, as long as you're getting X amount, then that's all you need to do. And I guess the other problem as well that I see is that people with kidney disease are frequently told as a bit of a blanket rule that they need to be on a low potassium diet and a low phosphorus diet as well, which is definitely not the case for everyone. Some people with kidney disease, yes, may need to be on a low potassium diet, but it's definitely not a blanket rule. And I guess the problem with cutting out those foods, particularly the higher potassium foods, is that there are a lot of our alkaline fruit and vegetables. There are a lot of our fibrous foods. They've got a lot of phytochemicals in them. So they've got a number of other benefits in the body, as well as giving us potassium, because potassium is also super important for the body. But if we're cutting those out or reducing them, then it's not necessarily beneficial for our health.
So why do you think that kidney dietitians are saying to cut out potassium? What is it about kidney disease that would lead to a blanket rule like that?
Yeah, so the kidneys are responsible for excreting potassium from the body. So they're sort of our balancing organ in terms of potassium. If we've got too much going around in our bloodstream, then we'll wee more out. If we have a bit less, then we won't wee as much. So it's trying to keep our blood potassium levels within a certain range. Problem is that as kidney disease progresses, then it can lose some of that ability for excreting potassium. So we can get a build-up in the blood. In saying that, that's not the case for everyone with kidney disease, and it's not even necessarily, it's not even like we can say everyone from stage 3, 4, end stage has to be on a low potassium diet. Again, it's different for everyone. So I'll see some clients who are in end stage renal disease whose potassium levels are completely fine without being on a low potassium diet. And then occasionally I'll see someone who's in an earlier stage whose potassium levels are elevated. So, there's a lot more to, I guess, our potassium levels than just our kidneys. So it's also affected by things like medications that we're taking. So again, it's being able to assess if someone's on a medication that may increase their potassium level or decrease their potassium level. How acidic the body is as well is going to change how much potassium we're excreting. So if we're eating a more acidic diet, then we've got more of a chance that our potassium levels are going to be elevated. So I guess long answer to that. But everyone's different, I guess, is what I'm trying to say. And they can't be a blanket rule for everybody.
No, I totally agree. And what are the issues of high potassium? Why would a nephrologist or a kidney dietitian want to avoid someone having high potassium levels?
Yeah, so high potassium levels can cause a lot of issues in the body, and I guess probably one of the primary and the most severe is to do with the heart. So part of the role of potassium is in muscle contraction and also in nerve impulses. in the body. So our heart's a muscle, but our heart also has a electrical system as well. So if our potassium levels are too high, it's going to put either of those things out. Can start with people having heart arrhythmias, so where their heart rhythm goes out of balance, and can, eventually lead to heart failure or death if it's not treated.
Okay, so there's good reasons why maybe they put in a blanket rule, but as you say, it's you give people right in end stage kidney failure with normal potassium levels. What are the dangers that if everybody was to follow that blanket rule and take potassium out and follow a low potassium diet, what are the implications for having not enough potassium or chronically low potassium, or like you mentioned, avoiding those amazing alkalizing phytochemical foods? So let's talk to the low potassium levels on top of then missing those foods out in your diet.
So interestingly enough, some of the symptoms of having low potassium are very similar to having high potassium. So again, we can get heart arrhythmias. So where our heart's not working properly, this time it's not because we've got, too much potassium, but we've got too little. Mm-hmm. Things like weakness, muscle cramps, fatigue, confusion, and progression of kidney disease as well, if we don't have enough potassium.
But not having enough potassium will make kidney disease worse.
Yeah, so they've looked at quite a large range of studies looking at potassium levels in people with kidney disease, and those who had low potassium, that was linked to an increased progression, quicker progression than those who had normal potassium levels.
And herein lies the problem with blanket rules and diets. So, naturopathically, we would go, okay, the best thing to do then is to keep the potassium between its really specific homeostatic range that it needs to be, rather than blanket ruling everyone. So how would we do that? What are some of the tests that we can do? What are some of the side tests that we can look at to know whether someone's potassium needs to be bumped up or bumped down?
Yeah, so easiest way to do it, blood test, checking for potassium levels.
Yeah. And that's 100% accurate?
Yeah. I mean, the results can be altered if there's been a problem with the process of the blood draw and the testing. Mm-hmm. And that would be the most time that you'll see often that it'll say that someone's potassium's higher than it actually is. Mm-hmm. But generally speaking, as long as there's been no issues there, it gives a pretty accurate result.
And how quickly can potassium levels change? Like how often, if someone was worried about saying their kidney dietitian said you have to stay off, we're saying you need to put those foods back in, how often could you test that and be able to feel quite comfortable that you were going to pick up any swing or changes in potassium without leaving it potentially too late for either direction, low or high potassium?
So I'd say particularly if, maybe you have either had low levels or high levels, so your levels have been abnormal, you'd probably want to be looking at them about once a month over a period of time and making sure that you're keeping them within the correct range. If your potassium levels generally are stable and you haven't had issues with them being low or high, then I'd say for most people about every 3 months.
And with that then, what are some other ways? So we obviously know potassium's really high in our alkaline fruits and vegetables and things like that. But we have a way, we talk about in the book, the leaching technique. Do you want to just walk everybody through some techniques that we can use to keep those foods in? And if you happen to have to lower your potassium because it is indicated as being high on a blood test, what you could do maybe to keep those foods in and keep the benefits of those foods, but help with the lower potassium.
Yeah, so for vegetables, sort of particularly high potassium vegetables, we can leach potassium. So leaching, so by that we mean basically draw potassium out of them before you eat them. And the best way to do that is to peel them, cut them up into small pieces, put it in a pot of water. So you want to have them in the water for a minimum of 4 hours, or pop them in the fridge overnight, and then boil the pot, drain it, rinse all the water off, and then do the whole process again, not waiting the 4 hours, but boil them in water again, then rinse and drain, and then you can then eat them, and that'll take out a portion of the potassium. I guess the main thing there to say is get rid of the water. Don't add the water to cooking or anything like that, because that's where the potassium is going to be.
So you don't want to go drinking a nice big glass of potassium water.
So
let it get right. Soak for minimum 4 hours or overnight. Then you boil it. Then you throw that water away. Then you boil again, and then you're good to eat. Throwing that water away again. Perfect. So I think the big thing that we want to say here is that naturopaths, naturopaths and integrative medicine practitioners, we look at things very differently because we don't apply a blanket rule. It's, our big credos is treat the person, not the disease, treat the individual, not the symptoms. So we're not treating people in the program or people listening to this or anyone with kidney disease as a disease. We look at you individually. And I have to say, in what I've seen, and I don't know whether what you've seen, it's not a big percentage of people that need to avoid potassium. So I'm always surprised it's a blanket rule. I would say in all the kidney disease I've seen, it's maybe only ever 10% where their potassium is legitimately raised. And as you say, it's normally medication. It's due to blood pressure medication is often what's bumped that up. That's my experience. I don't know if you have a different experience with that.
Yeah, no, I'd say the same. And I'd say, I guess then thinking about working in the hospital, people with the later stages of kidney disease, if anything, their potassium's often low because they're often on diuretics. So tablets to get rid of fluid in the body, and some of the main ones, I guess, that are used get rid of potassium. So we'll sometimes have to supplement people with potassium.
In end-stage failure.
Yeah.
And as you mentioned before, and I just want to say this again for people listening, and if you listen to Emily in our previous video, we get a lot of hate comments about us saying differently to this. And we really wanted to address this, of why we say this is that having chronically low potassium levels will speed up the decline of kidney disease. Meaning, if you go with a low potassium diet and you don't need to, you are potentially walking faster towards having dialysis than you need to, which is why we wanted to put this video together, and we're so passionate about it, because it is not a one size fits all. We are big on looking at the blood tests, treating the person, and what do you need. And it's, yes, of course, diuretics will of course excrete more potassium. So it's interesting in your experience, and Emily works in a large cardiovascular ward in a big hospital in Melbourne, Australia here, that you're often having to supplement kidney disease patients with potassium because of those issues. So, okay, so that's, anything else you want to say about potassium before we cover phosphorus?
Nope, I think that's it. And I guess, in part of that is, if you've got kidney disease, if you've got any condition, getting copies of your blood tests, asking for copies of your blood tests, not just having the doctor say things are okay or things are stable, but it's up to you to monitor your health. So if you've got those, you can actually look at your potassium over time, and that's going to help you make the decision of, do I need to follow a low potassium diet or not, regardless of what other people are telling you.
Yeah, it's very true, because you probably know this, but I often have patients come in, they're like, yeah, my doctor said all my levels are fine. And I may look at them. They might be in the recommended range, but I just had one yesterday where they said everything was fine and she's super fatigued, and her iron was like 9 and her ferritin was 31. Now, ferritin below 30 is anemic, and iron, she's right on the borderline. So I'm like, well, she's anemic. She also had small cells, which is a sign of anemia, but the doctor had checked her off as being okay. So sometimes we do look at things a little bit differently. And again, with a reference range is such a big thing too. It's like how it works in with the person, and those reference ranges just come from, I think in America they work from the standard population. Like in Japan, the B12 reference range is over 700 is healthy. In Australia, it's 200 to 700. Very different. And so I think Japan works more on optimal ranges. So I'm always wanting people's B12 higher. Yet, I'll often see people getting fatigued and their B12 will be 250. And I'm like, we're B12 deficient, but it's in the medical reference range. So it's always worth keeping that and tracking it and seeing if numbers are sliding or going up and down, and looking for patterns will often give you really good information. And if you're ever stuck the amazing Emily can help you with navigating your blood tests. Let's jump onto phosphorus quickly. It's not as contentious as maybe potassium is, but it is something we sometimes get asked for a list of low phosphorus foods, and there's a good reason we don't supply that, because it's in everything, and it's very hard to track the amount of phosphorus in foods because of the chemical constituent of phosphorus and it being in action, those sort of things. So do you want to talk to phosphorus and potentially why that may be an issue in kidney disease and what we need to do about that?
Yeah, so phosphorus, again, is another mineral, so a mineral that we get from our foods. And again, it's regulated largely by the kidneys. So as kidney function reduces or kidney disease progresses, the kidneys reduce some of that ability to get rid of phosphorus. And that's why we can get high levels in the blood. I guess the other thing about phosphorus is that it's also really important when you're looking at phosphorus that you're also looking at calcium, because phosphorus and calcium work in balance with each other. So often if your phosphorus levels are high, your calcium levels can be low, and sort of they can help a little bit in knowing how to treat it. But the main issue, I guess, with having high phosphorus levels is because, again, works in balance with calcium, the body is trying to get more calcium. So it actually pulls calcium out of your bones. So that means that people are at higher risk of osteoporosis or having fragile bones or bone fractures. But it also that calcium can deposit in your blood vessels, in other organs, in your heart, increases the risk of heart attack and things like that. So yeah, having high levels of phosphorus is something that definitely you need to be aware of. As Fiona said, it's really difficult because it's found in most foods, lots of foods. So unlike potassium, where it is achievable to follow a low potassium diet, for phosphorus it's not always enough to be reducing the amount of phosphorus you're eating.
And so in those cases, if someone did have high phosphorus, being that we're saying the diet is really hard to achieve there, how are people managed with high phosphorus blood tests?
So typically they'll be put on a phosphate binder, so a tablet, which role is basically to bind to phosphate in your gut so that your body can't absorb it. And there's different types of phosphate binders. So people are on sort of differing ones depending on your doctor and what else is going on, but the whole idea is that it's stopping that absorption of phosphorus in the body. And
out of, like you and I both said, we only see about 10% of people in kidney disease with high potassium. What is it, even more or less with phosphate? Because I've never seen a person with elevated phosphate with kidney disease, but you're in a cardiovascular unit, you may see that being completely different to what I see.
Yeah, I probably see it as very common in people with end stage renal disease. I would say majority of them would be on phosphate binders. In the earlier stages, less common, and if it is elevated, it's generally only slightly elevated, so I'm not seeing sort of really high levels. But I would say in the later stages it would probably be more common than people with high potassium even.
And it's I guess it's one of those things too, that dialysis, that's one of the purposes of dialysis, right, to help balance and pull things out. So maybe in those end stages when people are dialysing, whether that helps balance the potassium levels. Do you find that, or do you find that's independent of that?
Yeah, that can definitely. So definitely you'll generally see their potassium levels drop after dialysis.
Yeah. Okay, anything else we need to say about phosphorus or potassium?
I don't think so. I think we've covered most of it.
I think the big takeaways are potassium, near impossible to follow low potassium diet, unless again, it's fruit and vegetable, but it's in everything really, like even down to, I don't know, like things we wouldn't want you to eat. I know it's mainly in your milk and dairy and those sort of things, so we don't want you to have those anyway, but if that happens to become high, then we've got the option of phosphate binders. And I guess the other big takeaway we really want to hit home with today is that unless you've got elevated potassium on a blood test, then you don't need to follow a low potassium diet. There are actually risks of having too lower potassium in your diet, because we now know, and maybe if we dig up that study, we could add it in the show notes down the bottom. But yeah, we now know that chronic low potassium levels in the diet will actually speed up the progression of kidney disease. And it's why naturopaths generally, and here at Kidney Coach, we will never apply a blanket rule about something like that, because again, we want to treat you as a person and not a disease, and treat the cause, not the symptoms, which is the naturopathic 101 creed that we follow, along with do no harm and those sort of things. So, Ems, thank you for joining me to explain that. It's something I've really wanted to sit down and put a video together on, because it's, again, probably the biggest comment that I see on Facebook, particularly because we're often putting pictures up that might have a tomato in it. People near on have a heart attack every time we do it. So now you know why we are sticking to our guns about that. And it's not because we don't believe in it. We do. There's definitely times where you do need to follow a low potassium diet, but also we know that if you do that and you don't need to, you're going to potentially make your kidney disease worse. And that's the last thing we want here for any of you. So Emily, thank you again. And remember to hit subscribe below so you know whenever we put out a new video. And if you haven't already and you want to know more about what Emily does and what we do, head over to kidneycoach.com. You'll find a pile of amazing articles. There should be a big resource center there, and our program and supplements to help anyone diagnosed with kidney disease. And if you have any questions, we've got the amazing Emily and Rachel, our other naturopath. They're our full-time support team and to answer your emails. So we're really blessed because, again, you get really quality support whenever you are part of our kidney disease solution family. So we love you guys. Take care and eat potassium. We'll see you next time.